Hi Health Source Mount Pleasant followers, it's Dr. Brunner and welcome back to Mobility Monday. Today I'll be covering prescription 9, which will be covering the hip. This prescription 9 is great for helping to alleviate or clear out any hip impingement, hip pain, hip range of motion, and also low back pain. And I'll be demoing some next. The first mob is the anterior hip mobilization. I'll be using a small red mobility ball, placing it on the front of that anterior musculature of the hip. And we're doing a couple of different movements. We're going to be doing contract and relax into that ball for about 5 seconds and relax and let the tissues sink deeper into the ball. We'll also do a pressure wave side to side, a cross friction massage, and then also getting some movement or flossing the leg, bringing your heel to your butt on that side. Going about 2 minutes on each side, and that is the anterior hip mobilization. Next, I'm going to demonstrate the classic hip extension. So we're going to get into a lunge position. You're going to squeeze your back down leg glute. That locks in the pelvis and keeps the low back safe so that you're not overextending through this movement. We're going to then shift the weight forward as we squeeze. Helps really bring the anterior muscles nice and tight, getting that stretch that we're looking for. And then finally, we're going to bring that same arm overhead and slightly deviating laterally away. We're going to go about 2 minutes. Going to contract and relax through this movement. The problem with the classic hip extension is that it doesn't account for the hip capsule if there's any restrictions. So here at the clinic we'll utilize the bands from rock tape to help aid in that distraction anteriorly to open up that joint capsule even better. So I would do this for about 2 minutes on each side to really free that up. The next mobilization is called the couch stretch. It was first demonstrated by Dr. Kelly Starrett of Mobility WOD while he was watching TV with the kids and family so that he could get some mobilizing done at the house. So I love to bring that to the clinic and do the same thing here, or whether you're at work or home, this is a great one to do if you've been sitting a lot. So you lead off with, we're going to take the left leg, we're going to put the knee in the back between the wall and the floor. We're going to then come up into a lunge position here. We want to have butt back to that heel here. We want to be able to not be overextended at this low back, so we want to squeeze that back down glute, keep everything in. And this is the full range of motion we want to be able to see at the hip flexor and the quad. If this is not a comfortable position for you, you can either stay down through here with your foam roller and practice 2 minutes on each side like this, or if you are able to come back up but you can't squeeze your glute to activate, bring that out about a 45-degree angle, and again, squeezing here, looking forward, breathing nice and easy, keeping spine, good neutral posture, looking forward, and going 2 minutes on each side. A couple of desk-bound variations to the couch stretch that you can do at work or at home would be to put that knee in the back of the chair. Same rules apply. Squeezing your butt, bringing that tissue tight in the anterior side of the capsule, and hanging out here for 2 minutes on each side, or taking a step further, doing the same thing, bring that knee straight down off the chair, lunging out, and squeezing that down side for about 2 minutes on each side. Next mobilization is the single leg flexion and extension mobilization. So we're going to start with the right leg forward. We're doing this on both sides. Again, squeezing your butt here, setting the pelvis so we can start. But the main thing we're trying to focus in this time, instead of the back leg, is going to be the front leg. So we're getting flexion here. It's kind of our squatting mechanics that we want to have. And then we're going to kick that knee out so it's over the pinky toe, using our elbow. And we're just sinking down that leg as far as we can. If we can get our elbow all the way down, that's great. If not, we'll just hang out here. And we're looking to oscillate at the hip, going clockwise and then counterclockwise, freeing up that capsule going about 2 minutes on each side. A banded variation of the last mobilization that we do at the clinic is with the red rock tape band to help distract that hip joint, the hip capsule out laterally so we can free up more space, kicking that knee out over the pinky toe, and then sinking our elbow down to the floor as far as we can and going 2 minutes on each side. The desk-bound variation for hip flexion and external rotation is right at your work or countertop, table at home, is putting the leg up on the top of the table. And again, we're trying to push that knee out over the pinky toe and sinking in. You bring your back leg back further and just sinking down, going 2 minutes on each side. Really feel the bottom as if this is mimicking the bottom of the squat. And that does it for prescription 9. Next week for Mobility Monday, I'll be covering prescription 10, which is over the upper leg. So I look forward to seeing you. Have a good week.